A patient consumes large, frequent meals. They experience ravenous, demanding hunger. Yet the physical body rapidly loses flesh, continuing to waste away no matter the volume of caloric intake. This severe metabolic contradiction forms the core pathology of the homeopathic remedy, Abrotanum, derived from the southernwood plant. The clinical profile of Abrotanum points heavily to pediatric cases suffering from marasmus. Marasmus is a state of extreme undernourishment that causes an infant or child's body weight to drop significantly below normal levels. The remedy rests on two primary pillars. The first is asymmetrical marasmus. The physical wasting does not occur evenly across the body. It is intensely localized. The second pillar is pathological metastasis. In this clinical context, metastasis refers to a dynamic where symptoms do not resolve, but are instead suppressed and violently migrate to entirely different organ systems. To understand Abrotanum, a practitioner must construct a unified clinical picture, connecting seemingly unrelated physical and psychological symptoms, tracing the pathology from wasting legs to extreme mental cruelty. This diagram outlines the anatomy of an Abrotanum patient, mapped into three distinct clinical zones: the lower extremities, the gastrointestinal tract, and the brain. The patient cannot be evaluated by isolating a single localized illness. They are experiencing a total, cascading failure of the entire systemic network. The physical wasting presents a very specific topological keynote. The marasmus is strictly limited to the lower extremities. As illustrated in this diagram, the torso and upper body maintain a neutral baseline, while the legs rapidly shrivel and lose mass, creating an extreme physical disparity. The patient is actively eating, aggressively taking in food, yet shedding tissue. This graph maps the contradiction. High caloric intake enters the digestive tract, but assimilation completely fails, resulting in a steep mass decline. As the body rapidly consumes its own fat and muscle stores, the overlying skin loses its structural support. The tissue becomes profoundly flabby. This excess skin hangs in prominent, loose folds, a feature that is particularly visible around the patient's neck. While an emaciated, flabby neck appears in the clinical profiles of natrum mur and sanucula, the pattern in Abrotanum is distinguished by its accompanying systemic failures. The muscular failure extending into the upper body results in severe weakness in the cervical spine. The child loses the mechanical ability to hold their head up. This absolute neck weakness requires the practitioner to differentiate the case from athusa, a remedy with a similar presentation. The targeted failure of assimilation strips the musculature from the body's foundation. The legs cannot support weight, and the neck cannot support the head, physically anchoring the patient to the ground. The external wasting is driven by severe volatility within the internal gastrointestinal system. The primary bowel state is completely unstable. The patient experiences an unending alternation between constipation and lienteria. This flowchart tracks the continuous loop of the patient's digestion, swinging between complete blockage and explosive evacuation. Lienteria is a specific type of diarrhea containing entirely undigested food. The digestive tract functions merely as a conduit, passing nutrition through without extracting any caloric value. This creates a critical danger in clinical treatment. If a practitioner suddenly suppresses these secretions, trapped disease energy is denied an exit, forcefully redirecting the pathology into the joints, manifesting as severe rheumatism. The timing of this joint pain is a key diagnostic indicator. The patient suffers excessive, agonizing pain well before any physical swelling or inflammation actually begins. This establishes a pattern of alternating disease triads. The rheumatism surfaces when the diarrhea stops. It can also alternate with bleeding hemorrhoids or bouts of dysentery. When the gout fully develops, the wrists and ankle joints become stiff and swollen, accompanied by a sharp, highly localized pricking sensation. Blocked physiological exits act as pressure cookers. The unexpelled waste cannot leave the body, so it migrates inward, lodging deep within the articular cartilage. The localized joint pain and complete lack of nutrition culminate in a state of sweeping systemic exhaustion. The patient experiences extreme weakness, profound prostration, and an absolute inability to stand. the physical frame becomes incredibly fragile and completely depleted. Voluntary muscle control degrades, dissolving into persistent tremors and absolute listlessness. Affected children also present with a persistent, draining, hectic fever. A hectic fever is characterized by widely fluctuating daily temperature spikes, commonly associated with severe wasting diseases. Months of chronic starvation and migrating internal pain severely warp the patient's psychological baseline. The baseline mood of the child becomes deeply ill-natured. They are highly irritable, easily crossed, and heavily despondent. This progresses to an extreme mental keynote. The child crosses the threshold from mere irritability into harboring violent, inhuman desires. They develop a specific, unprovoked urge to do something cruel. The internal psychological cruelty and the severe bodily wasting eventually alter the physical structure of the patient's face. The child loses all signs of youthfulness. The skin of the face becomes pale and heavily wrinkled, taking on an exceptionally old appearance. This prematurely aged, wrinkled presentation requires direct clinical comparison to the remedy opium, which produces a similar facial keynote. The unassimilated nutrition starves the body, while the trapped metastatic energy corrodes the nervous system. The result is a child stripped of physical youth and psychological innocence. Reviewing the complete pathogenesis of Abrotanum reveals a clear chain of physiological events. Initial gastric malabsorption leads directly to physical wasting, which in turn fuels end-stage mental cruelty. This finalized clinical matrix maps the remedy across 4 distinct nodes: gastric malabsorption, lower extremity wasting, suppressed secretions migrating to joint inflammation, and a prematurely aged, cruel facies. The core dynamic is twofold. The inability to assimilate nutrition degrades the physical tissue, while the inability to safely discharge secretions generates violent pain and psychological distress. In practical clinical application, Abrotanum holds specific sequential relationships, meaning it successfully cures conditions left unfinished by other remedies. Abrotanum is highly indicated after the use of hepasulfuris in cases involving furuncles. Furuncles are painful, pus-filled boils caused by infected and inflamed hair follicles. It is also heavily utilized following the remedies aconite and bryonia in cases of pleurisy. Pleurisy is a condition where the thin tissue layers covering the lungs become severely inflamed. The exact symptom calling for Abrotanum after a pleurisy infection is a lingering, pressing sensation in the affected side of the chest that actively impedes the patient's respiration. For the prescriber, the case rests on 4 ultimate keynotes: a patient starving while eating, targeted wasting of the legs, wildly alternating bowel states, and a distinctly cruel disposition. Abrotanum demonstrates how descending marasmus and alternating disease expressions are intrinsically linked. To successfully prescribe it, the practitioner must look past the immediate joint pain and uncover the suppressed medical history of the patient.